now to answer some of your medical questions. And joining us with the answers is News Channel 5's medical specialist, Dr. David Soria. When he's not here with us, he's the chief of emergency medicine at Wellington Regional Medical Center. Thanks for stopping by.
You're welcome.
Our first question for you has been a subject that's been in the news this year. We did have a confirmed case this year of West Nile virus in Palm Beach County. So what are the symptoms? How dangerous is this? Should we be concerned?
Yeah, West Nile, we had 1 in the past 5 years, and we've had 7 in Palm Beach County since 2000. Sounds very rare, but believe it or not, it is not. It's actually very common. And the reason why we don't hear much about it is because 80% of the time, when you get bitten by a mosquito that's harboring the flavivirus, you don't develop any symptoms at all. 20% of the time you do, but they're mild.
Okay.
And then only less than 1% of the time you develop the severe symptoms, of which then we obviously investigate and make that determination. Mild symptoms are similar to the flu. Congestion, little achiness, nausea, vomiting, fever, goes away in several days. Most of the time goes undiagnosed, never even knew you had it. The severe symptoms could be confusion, mental status changes, even paralysis, and sometimes those are permanent. So it is something that's out there.
It can be fatal? It can be fatal.
It absolutely can be fatal, but in a rare case. So really there's no treatment for it. It's supportive care. Best thing to do, prevent it, and that is avoid mosquito bites. Stay away from standing water, damp areas at dusk and dawn when mosquitoes are prevalent, and if you're going to have to be out there, wear long sleeves, long pants, and insect repellent, and you should be good to go.
All right, good advice there. Our next question for you this noon, how common is gout, and what's the best way to prevent it? Maybe let's start with, what is gout?
Well, gout is a disease where you have increased uric acid in your bloodstream, and what uric acid does is it can form tiny little microcrystals in the bloodstream. Those crystals deposit in the soft tissue, and particularly in the joints, and then of course causes inflammation and pain. Very common. 5 million people or over that have it, typically men, 9 times more than women, and the age of which they have it the most is in their 70s. So it's a disease more of elderly people. What can contribute to it if in fact you have that predisposition? Dehydration, fever, injury to the joint. But let's talk more about the dietary issues. Increased alcohol consumption can do it. And then, of course, foods that are rich in uric acid or purines. What are those that you want to avoid? Typically red meat, organ meats like sweetbreads or liver, shellfish, a couple of vegetables like asparagus, spinach, and cauliflower, but also high fructose corn syrup, very rich in purine. Stay away. But believe it or not, dairy products actually lower the incidence of gout. So if you have gout, drink some milk.
All right. So good to know that at least through better diet, we can at least control it.
Yes, you sure can.
All right. Dr. Soria, thank you so much. If you have a question for Dr. Soria, you can get it to him quick and easy through our website, WPTV.com. Just click on that health link there, and you'll see a form that you can send him right on the right-hand side. We will check back in with Dr. Soria soon, and we will see you right after this break.